So you support the upselling of services at private facilities?
Well, I wouldn't call it upselling of service. I would call it patient options.
Ontario's Conservative government, headed by Ontario Premier Doug Ford, has announced their plan to bring even more American-style healthcare to Canada. Just wonderful. By now using even more public dollars to fund private facilities. This will not only not address the issue at the heart of the healthcare system, which is a lack of staff, but also will cost the province more to receive less in services. So in this video, I will break this down. I will go over the assumptions that some people are making about how this will really solve the problem when clearly it's not going to. And then I'll get to a clip from the health minister defending this on CBC and how ridiculous that was. And hopefully by the end of this video, you will understand why this is such a terrible plan. And also why Doug Ford did it, which is kind of given away here in this headline. Doug Ford pitches private surgeries offered by his donors as a solution to Ontario's healthcare crisis. This headline here from Press Progress. Ford touts private eye surgeries, like one lobbied for by a top Ontario PC donor in healthcare announcement. So a little more here on terms of what is actually happening. So in addition to lifting the cap on the number of IHFs, independent healthcare facilities, or private healthcare facilities, the number that can operate in Ontario, Ford also used the photo op as an opportunity to highlight the government's plans to privatize simple medical operations. Ford said Ontario residents can now, quote, knock off simple stuff that is not complicated, singling out knee replacement, hip replacement, cataracts as a few examples. Quote, these are no-brainers that are backlogging the healthcare system, Ford said. Now, on the face of this, without knowing anything, you may think, well, this sounds like a good plan. There is this issue with the backlog at these hospitals. Why not introduce these private facilities to help solve this backlog and cut down on these wait times? Because the issue isn't a lack of rooms. The issue isn't a lack of facilities. The issue is a lack of staff. So by introducing more private facilities that can offer these procedures, you are simply now taking or incentivizing professionals in the public system, incentivizing them away from that system into the private system, simply moving people around. You are not helping with the issue of a lack of staff. And in doing this, you are actually costing the province more because they have to pay more to a private company as opposed to simply just funding the public system. So we'll get to more of those details in a second here, but this is a comment from a surgeon in Ontario that says, I've worked in an Ontario hospital for the past 12 years. It's not that we have a lack of operating rooms. It's that we don't have enough staff to run them. How does building private surgical centers solve the staffing crisis? It doesn't. It exacerbates it. Going on to say, look up operating room nurse jobs in Ontario, and that should tell you all you need to know. Hundreds of vacancies, and staffing turnover is a huge issue. Maybe we need to listen to nurses when they tell us why they're leaving the profession. They've been telling us for years. So first, on the point on looking up operating room nurse jobs, this surgeon is exactly right. I looked it up, and there are hundreds of positions. The issue here is a lack of staff. Again, the issue is not a lack of facilities or a lack of rooms for these procedures. Now, in this video that I did back in August, this was titled, Doug Ford Goes American on Canadian Healthcare. I brought this up in terms of the nurse aspect of this, so I went a lot deeper into Bill 124. That is, I'll watch that video to get the whole perspective on that, but I want to bring up this piece of that. So according to data by the ONA, nurses' wages have increased by just over 15% over the last 12 years, from a max salary of $82,700 to $95,500 for full-time nurses with 25 years of service. That is compared to over 30% for both police officers and firefighters. So nurses have only seen an increase of 15%, police and firefighters 30%. All nurses are asking for here is parity with other public services. And you could argue that nurses should be making more than parity with those other services. But all they're asking for is parity here. And you can see how they have been completely disrespected by the Ontario government. And that, by the way, just isn't conservatives, also liberals. So this is an issue that crosses party lines. Healthcare has been largely underfunded, and it is the one thing that people need most. So let's get now to Health Minister Sylvia Jones, who is, of course, defending this move. Here she is on CBC News. This in particular is around the potential upselling that these private facilities will do with patients. So check this out, and I'll get to what the actual problem here is, as it may seem like it's something else based on what the anchor is focused on, but the issue is actually something different. But I'll get to that.
What is your position as minister on doctors upselling at private facilities?
So I'm going to give you a very specific example. And that is, first of all, I want to reinforce safeguards that already exist to ensure no extra charges for OHIP-funded services occur. However, upgrading of wheelchairs, perhaps choosing a private room over a semi-private room, or as it relates directly to cataract surgery, hospitals offering an upgraded lens as an option that patients can choose but are not obligated to choose. Those exist in both the community surgery centers and our hospitals.
So you support the upselling of services at private facilities?
Well, I wouldn't call it upselling of service. I would call it patient options.
First of all, so I'll get to the real issue here because it may not be what it appears to be. But this reframing of how they discuss this entire thing, oh, it's not upselling, it's patient option. That just means you're benefiting for-profit industry. That's all that is. That's all that's ever meant. But their attempt here to reframe what is just the same thing as upselling is just a blatant way to try and get around criticisms here. But let me finish this off.
Because as I said,
well, it's options that's not, the thing is, it's options that's not necessarily available to everyone. People who don't have the funds to pay that extra money for that extra service, or we're talking about lenses. If there's a better opportunity for a better lens, you have to have the money to pay for it. So is that not creating a two-tier system where people who have the money, and if that's what they want to do with their money, that's their prerogative and they want to do it. But does it not leave behind the people who can't afford it, that they don't get those same options as the people who can afford it?
Respectfully, Katie, no. I've given you some very specific examples. When an individual chooses to decide whether they want a semi-private room or a private room, that is a patient option that they make.
But we're talking about lenses. Let's talk about the first example you brought up, lenses, when it comes to that cataract surgery.
Okay, there's not much more to really that you need to know here. The issue is that there is already a two-tiered system. So the host here is making it sound like that this is just being introduced now, that these private facilities can now offer, better lenses. That already exists in the public system. So, and look, you can argue it's very likely that these private facilities will charge you more for the better option, but that better option already exists. So in terms of what premium lenses are, this is from the Baton Rouge Eye Physicians, saying here, premium lenses not only treat cataracts, but also address vision impairment problems like nearsightedness. Premium lenses can even provide sharper vision at far distances. This means you can reduce your dependence on glasses and contact lenses. So this is already offered in the public system. This is from the Ontario government healthcare website. A physician, and they're talking about the regular facilities here, the public facilities. A physician might offer patients lenses with features that are not medically necessary in their mind, such as multifocal lenses to correct refraction, tests that are not medically necessary for or for which there is a comparable insured test. So basically pointing out here that what is covered by your insurance, by your public insurance in Ontario is just the normal lenses. If you want premium ones, you got to pay more, regardless of if it's a private facility or not. So you may ask, okay, then what's the problem if it's already being offered? The issue here is that this is not going to solve the problem. This is not like the issue again is wait times, is people that need this procedure. There is a lack of staff that is able to give these procedures, that are able to perform these procedures, because there is a lack of funding in the healthcare system. So they attempted to reduce these wait times in the case of MRIs in Saskatchewan in 2016 with the pilot initiative that offered privately provided MRIs for those willing to pay. The pilot backfired Instead of becoming shorter, MRI wait times increased. And again, that's because it didn't get to the heart of the problem, which I have to assume there as well was staffing. The issue was not a lack of rooms for procedures. So this is where we get to the incredible waste here, because this is really like, the idea that Doug Ford cares about the budget. That's what he's focused on. gotta rein in that spending. Here he is spending more for less. So the Ford government's plan to pay private for-profit clinics for cataract surgeries will cost Ontario at least 25% more per operation than when our hospitals, our public hospitals, do the surgery. Politically connected lobbyists are behind this plan, of course, which the health ministry is quietly enacting while Ontarians are preoccupied with the COVID-19 pandemic. So why do they bring this up? This COVID, I don't know why I clicked that. Why do they bring this up? This article is from 2021. They were already doing this. They're just expanding it now. They're doing even more of this. So this has already been going on, meaning these wait times have not improved. If they've already had this in place, then we would have seen these numbers come down. They have not come down. Yet so they think, well, it's not coming down because we need more, even more private facility. That's the problem. Why would that be the problem when this didn't solve the issue? So this is just more wasted province money being thrown at private companies to enrich wealthy healthcare executives, when that money could be going to nurses. It really is disgusting. And of course, as mentioned, lobbying at the heart of it. The owners of a company lobbying to expand privatized eye surgeries donated thousands of dollars to Doug Ford's party. Ontario recently began licensing private clinics to conduct eye surgeries as independent health facilities. Again, I believe this is also 2001. Sorry, 2001. 2021. Just, 20 years off. 2021. So this, again, has been going on, and it clearly didn't solve the issue with wait times for cataracts. So, and going to how great our actual public system is when it is staffed and people can perform these surgeries, Ontario has a world-class vision care system where cataract surgery is provided by internationally respected ophthalmologists and nurses who are proud to work in a publicly funded, not-for-profit system. Experience with Ontario's Provincial Vision Strategy Task Force makes it clear to us both how good our eye care is. It is also evident that an increase in hospital operating dollars is needed today to apply that cost-effective excellence to clearing the pandemic backlog. Why is the Ford government instead promoting for-profit cataract surgery to flourish when it could be investing in more efficient and more equitable not-for-profit eye care? And of course, they go into the issue being well-connected lobbyists. And that isn't even really the issue. The issue is that Doug Ford is doing what they say. So Chandra Pasman here, this is an NDP MPP, saying as Doug Ford expands private clinics in Ontario, patients will pay more out of pocket, the public system will lose workers, making wait times even longer, and a few lobbyists and PC donors will rake in the big bucks. Doug Ford is not on your side. And just to end on this, sort of a summary of how private for-profit hasn't worked. It's been tried in Canada, has not worked. So this is from BC Health Coalition. Contracting out surgical services to private companies is at best a short-term measure, but evidence shows it to be counterproductive in the long run. So here is some of that evidence. Higher costs for the public to as compared to the public system, where profit margins are not factored in. Back in 2016, BC's plan to pay for-profit clinics for MRIs was nearly twice as expensive as the same service within the Vancouver Island Health Authority. So similar to what you're seeing in Ontario, where it costs more for less service. Lower quality and less safe services. Another example, both Canadian and international experience shows that private for-profit facilities often cut corners to reduce costs, including hiring fewer and less skilled personnel. Just take a look at long-term care facilities. for-profit versus the public system, most of the major issues during the pandemic were in the for-profit long-term care facilities, not in the public system. Because again, they want to, the whole point, for-profit, they want to make profit. So they reduce cost wherever they can to make as much profit as possible. Whereas a public system, there isn't that issue. You want to ensure that the actual focus in a public system is on the patient. The focus in a for-profit system is on the bottom line. 2 more points here, or 3 more points here. A rise in inappropriate surgeries when a clear profit motive drives recommendations for more and more expensive surgeries. Private for-profits also have an incentive to take on easier surgeries, leaving the public system with more complex cases, which we're already seeing as being encouraged by Doug Ford, saying how these for-profit ones will take only the easier surgeries, so burdening the public system with the cases that are much more complex. A drain of human resources from the public system as profit incentives pull from the same limited pool of health professionals. That is the major issue in Ontario. And no improvement to wait times. The 2010 Saskatchewan Surgical Initiative, which made use of charter facilities, showed a slight reduction of wait times in the short run, but an overall increase in wait times in the long run. Because again, the issue tends to be staffing. So this is not going to solve the problem. There is a potential that in the short term, there may be some improvement. And there may be reports being, oh, Doug Ford's plan's working. But you have to see how it plays out in the long term and what it will do to our healthcare system. Underfunding it while funding for-profit private facilities is not a long-term solution.